I think it's the same advice I would give anybody. Find out what you're passionate about and commit yourself to doing that. And if you do that, I think your life will be complete, whether it's both professional, personal, however it might be. So, commitment to family, commitment to career, commitment to the field you're in, I think would be the advice I would give myself and my children. Um,
It's
because at the end of
fantastic.
the day, if you do that, it doesn't really matter what your job is or anything. If you really love doing it,
Hello and welcome to another episode of the Break Free podcast, where we're shining the light on entrepreneurs and business leaders that are really changing the world for a better place with their enterprises. And today, I'm so excited we have with us a very special leader. Sam, welcome to the show.
well, thank you, David. I'm glad to be here and looking forward to sharing our thoughts and experiences.
Wonderful, Sam. For the audience, can you give me your full name? Where do you live, and what do you do for a living? What's your current position?
So, full name is Sam Terese. I'm the president and CEO of Alverno Laboratories. Alverno Laboratories is a integrated laboratory network of lots of hospital laboratories, physician office testing, many special kinds of technology. We are housed in a little area called Hammond, Indiana, which for those that might want a little bit easier geography, we're about 25 minutes from downtown Chicago. So we're here in the Midwest. Looking forward to spring and getting ready for the eclipse here coming up in a few days. So
Are you going to be
uh,
on the path?
uh, we are not directly on the path, but several of our hospitals, particularly down in Indianapolis, are clearly on the path. So we've been planning for traffic jams and all sorts of things that will be kind of exciting. So uh,
They say that some cities are expecting millions of people that want to see
yeah.
it, right?
Yes, I mean, very large, substantial crowds. So most of it is not so much concerned about people's health. Of course, that's part of it, but just the amount of traffic and how to get through it and around it should somebody really need to get to one of our hospitals. So it presents some challenges. Not that we're not always prepared for those kinds of things, but this one's rather unique.
For sure. And they said the next time is going to be in 20 years or something.
Yep.
So,
So I hope I'm still around for that one in 20 years.
Sam, talk a little bit more about your organization. You guys are a laboratory, but you also have hospitals, or how do you do your business?
Yeah, we're kind of in this unique space of a diagnostic laboratory, and we're not always the ones that most people think about in healthcare because we kind of live behind the scenes, but probably something that every single person has had some interaction with, whether they've had a blood test drawn or had a medical procedure. Usually behind the scenes is a laboratory result that's guiding the physicians in their decision making and making diagnosis and treatment of their patients. Alverno is kind of this unique organization in that while we have this large central laboratory here in Hammond, we have many laboratories throughout Illinois and Indiana, including somewhere in the neighborhood of 30 plus hospital laboratories, which are all run and staffed by Alverno. Many laboratories in urgent care facilities, laboratories in infusion centers, uh, laboratories in physician offices. And then we have a whole nother realm of work that we do with physician offices. So there's probably about 4 to 5 thousand physicians that use our laboratory as well. So we, on a given day, we're moving maybe 30,000 patients samples through the system.